How's it going, everyone? Dr. Dan over here. We have Lisa, the Fit Survivor, and she's going to do a little intro of herself, but we're going to shoot a typical one of her chiropractic appointment videos where we do a little muscle work to some of her problem areas. We're going to get her adjusted and then show her an exercise that you guys will get to see. But why don't you tell us a little bit about yourself, Lisa?
Hi, my name is Lisa Nicolette. I'm now a 10-year breast cancer survivor and NPC figure competitor. I just did a show last week. I found Dan pretty much on my own after 2 back-to-back car accidents that happened earlier this summer. So I needed some help with my back and neck challenges. So thankfully, Dan is one of the best chiropractors I've ever seen yet. So I'm learning a lot through his unique form of chiropractic care, and it's also, I believe, going to make me a better competitor.
Awesome. So with Lisa, some of the things that we've been working on is taking some of the tension out of her neck, right? So as a bodybuilder who's had years of training before she came here, we're teaching her how to put her strength in some different places, right? So
Absolutely.
one of the things we're doing, teaching her how to create more length in her neck and more strength in her back and her core. So we've already gone through some diaphragmatic breathing, some lat activation, and really what you'll see at the end of this video, one of the exercises that we're gonna teach her how to build some delt strength, right? And some bigger lat strength.
Lats.
Yeah, bigger
Get
lats,
that nice
right?
V-taper.
So we want to be a nice flyer, right? We want to develop those big wings, and that's something that a lot of bodybuilders, they develop big lats, and just fitness people in general who really, when they're doing shoulder presses and things, they put too much tension up in the neck, right? And that's kind of one of the things that we've been working on, is teaching her how to drive tension down into your core, down into your lats, and keep the neck nice and soft. So why don't you just have a seat right here? Okay, now, so we're gonna go through and we'll cut a little bit of this out, but what we're gonna do in her neck, her mid-back, some myofascial release up to the neck muscles, into the upper trap muscles. She's had, from the car accident, and also just, I think, some previous overuse of some of her right neck. You can feel like right here in the
I can feel
mid-back. So when we first started working with her, she was really jammed up in her neck. We've already made huge postural improvement, correct, in the mid-back as you've started to kind of find your lat muscles and work a little stronger, okay? All right, so let's start with a little bit of muscle work over on the left side. And as you guys, I'm going to cut this out, but as you guys have seen in previous videos, one of the things I do with each of my patients, some myofascial release or muscle stripping. Look up straight for me, down straight, up into the lateral neck muscles, the posterior neck muscles like the upper trap, and the suboccipital muscles at the base of the skull that get really kind of jammed up and tight. Lisa was in a couple car accidents back to back and was having some pretty significant neck discomfort, upper back discomfort. Look up straight, down straight, and right here. All we're doing here, look up straight, down straight, up straight, is some muscle stripping or some myofascial release to help take some of the tension out of her neck. And as we work on her neck and her upper back, we're going to teach her how to direct some of the strength, the overuse, the tension that's created up in her neck. We're going to teach her how to put it back down into her mid-back, down into her core. Go, look down, up, down. And there's not too much going on over on this left side, is there? A little bit like right up here.
Right there.
So sometimes when we do this muscle work, like the whole neck is sore. And I think when we started with Lisa, there was a lot of tension from the car accident, from the whiplash, from some of the muscle damage and the ligament damage. She's got a little bit of compression or a little bit of irritation still up in the base of her neck, but so much better on this left side. Look down and right now, straight up, straight down and right, up and down and right. Good. All right, sit up nice and tall for me. And now we're going to move over to the right side of her neck and do the same thing, just a little muscle work. Straight up, straight down. And what we're doing, the same thing over here on the right side of her neck, where post-car accident is where most of her injury was at, up in the upper right side of her neck. Her right SCM muscle, the sternocleidomastoid, which is the muscle that you see when I tilt my head, this big guy pops out right here. And that's where she's had a lot of the neck discomfort, and you can even feel kind of like how you're still a little compressed. Look straight down for me, or just a little irritated, right in that little lump right there. Yeah. So chiropractors and physical therapists and different kind of manual therapists who treat muscles and joints can typically kind of feel where the tenderness is, where the irritation is. And what that tells us is there's just a dysfunctional muscle. It can be a tightened up muscle, it can be an injured muscle, it could be tied into the joints, the nerves in the surrounding area. Look up straight and down straight. Good. And what we want to do is take that tension out of the muscle, either with exercise, with myofascial release, with adjustments, with different things that will help to promote blood flow and circulation and reestablish proper neurological function, proper strength of the nerves, the muscles, okay? All right, so right side right here, we're gonna do a little work on. I'm gonna pull your hair right over here. Look up straight for me, down straight, up straight, down straight, up, down, and this right shoulder, so much better. Down.
It's like night and day.
Night and day. So when we first started with her, she had a lot of tension and irritation up in the right shoulder, the right side of her neck. Look up straight, look down straight, look up, look down, look up. And it's minimal now. So pain has decreased. The muscle has calmed down. Keep going up one more, down one more, hold, up, down. But you can feel right there. Right there it is. All right, up, down is where there's still just a little muscle inflammation that we're just ironing out. We're just helping to loosen up, and down. Perfect. All right, and then we always check. Sometimes in my other videos, you'll see how we check. Just relax your shoulders for me. We check the shoulder movement. So we're checking the glenohumeral joint movement. When I pull back on her shoulder, you can feel how there's a little movement in there, right? And as we do this, we're just creating some healthy joint mobility, some pumping in the joint, which helps to get synovial fluid and circulation moving in the joint. We never want things to be tight and stiff, right? If they're tight and stiff, they grind and they wear and tear, and that's how people hurt themselves. So when a joint is loose or decompressed, it pumps nice and easy, and we get a lot of fluid movement, right? All right, so we're going to do a little different. Feel this little trigger point in your infraspinatus here. All right, so hopefully this isn't. It's quiet. All right, so I don't know if we use this on you yet.
I don't think so.
No. This is called hypervolt, right? This is a hypervolt. It's a percussion device or a massage device, right? We're going to use this in this infraspinatus area right here. And you'll feel how it kind of gets just deep breaths for me, okay? And this is an awesome tool to help break up some of the tightened up areas within the musculature. A lot of people develop trigger points. You okay in here? Yeah? You can feel this guy right here?
Oh, yeah.
So she's got a big trigger point / muscle strain in her infraspinatus muscle, as most people do. We're going to teach her a back exercise after we finish up here that's going to help to reactivate the lat, the middle trap, and the rhomboid, and take some of this tension out of the infraspinatus, okay? So you know as a bodybuilder how sore you get.
Oh, yeah.
Right? After all the lifting and posing, right? Strike a pose, all that good stuff. Muscles get sore, they get tight. This is an incredible tool in addition to hands-on myofascial therapy, deep muscle work. This is an awesome tool, this hypervolt, that also helps to promote circulation. And she can feel this little thing right in here. All right, now we're going to go right in the center spine. Or left side of spine, up into the neck, shoulder blades down. And this is her first session with the hypervolt, so we're going a little lower. We're on the lowest setting. Next appointment we'll crank it up to the second setting. But today we're just going to get her acclimated. You can see how the right side's a little ticklish / tender. Ticklish tender means some kind of dysfunction, little muscle inflammation, nerve inflammation, or irritation. And you can feel how I can kind of sense like that little thing right in there and right up here, okay? All right. All right, so Lisa has also had, you still videoing or we'll?
You're good.
Yeah. So Lisa has also had some ongoing plantar fasciitis and some calf tightness, a little bit of Achilles tendonitis down the legs. A couple appointments ago, we taught her some bridging exercises to work on her hamstrings and her butt. So we're trying to connect her brain down to her leg muscles, like her hamstrings and her glutes. And today we're gonna go through and do a little muscle work down in her calves, right? So if you can just kick your shoes off for me.
Okay.
Awesome. Just relax your foot. Okay, so Lisa's also, over the years, how long have you been dealing with ankle pain, plantar fasciitis, foot pain? Months?
I'd say probably 6 months.
6 months. And plantar fasciitis, if you've ever had, it's not a fun thing to undergo. A lot of people have trouble walking daily. Sometimes people get out of bed, they can't even put pressure down on their feet because of how tight the plantar fascia gets, how restrictive or inflamed it gets. So what I commonly will find, and this is not true for everybody, but true for a lot of people, is that the gastroc and the soleus muscle, a lot of people overuse these muscles, right? So we can actually see right in here, you're gonna feel a little spot right in there. You feel that thing? So right here, I can see, I don't know if you can tell on the camera, there's a little divot right in here. And that's where she's got an old muscle strain, sprain, tension spot in the calf. You can feel it right in there, correct?
Yes.
This muscle, it tightens up and it starts to pull, and it causes compression of the Achilles tendon, irritation, inflammation. It can cause shortening of the plantar fascia, and ultimately we end up with this foot problem, which most doctors will treat with something like an orthotic, which doesn't fix the underlying problem. And generally the underlying problem is weakness or inhibition somewhere up the line. So hamstring, glute, leg. Okay, just nice deep breaths for me, Lisa. Relax for me. Okay, now we're gonna do this leg because she's had some bilateral plantar fasciitis, right? When anything's bilateral, both sides, typically it means something is going on up in the core or the middle of the back or even the lower back or even the glutes. We've taught Lisa already some glute activation exercises, how to kind of consciously begin to use her butt muscles a little more, which ultimately will help to take tension and overuse out of the calf muscles, and she can feel same kind of deal. If you look right here when I run this tool, now I feel the bump, she feels the bump, but you can probably see there's just a little baby divot right there. You can feel that in there, correct?
Oh, yeah.
Oh my, right? And what we're doing with this instrument, this fascial release tool, is helping to promote blood flow down into the dysfunctional muscles and really just promote healing, right? And so as a bodybuilder and somebody who's competed and lifted, how many calf raises have you done? Thousands, right?
Thousands.
Tens of thousands maybe of calf raises. And calf raises, when we're flexing the calf, right? Doing a calf raise up and down, your calves get sore. They get knotted up. They get overworked. And so long time ago, right? 10 years ago, 5 years ago, she might have, maybe 20 years ago, she started to develop strain in the calf, an overactive spot that wasn't treated with muscle therapy or myofascial release. Maybe you did, I don't know. But now we still have some damage in the calf that we've got to clean up. And the cool thing about the body is that it's always regenerating, right? So it's always regrowing. And as long as you, just like a plant, water it and feed it and give it some sunlight, the muscles will regrow in a lengthened, healthier position. And all we're doing is helping to promote some blood flow. All right, relax for me. Okay. So as we work on her feet, we can see how the left leg kind of just turns in a little bit more. I'm going to do a little more release on this calf here. And then even on your next appointment, we're going to spend some time, okay? Remind me, because we'll jump back down here and start to work these guys out. Give you some more exercises to help. Loosen this calf up. All right, cool. Okay. All right. Bend up here. Push into my hand and stop, 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 and push and stop. So one of the other areas that we're going to work on, push, and we've started to, push, stop, is developing better glute strength. All right, so glute strength, building a good strong butt is really, really, really super duper important. Push, stop, push, stop, push, and stop. If you watch our other videos, our exercise videos, there's 3 things we really try to teach people. That's your 3 B's. We got to learn how to breathe strong. We got to learn how to use your back muscles nice and strong, and we got to learn how to use your butt strong, right? So breathing, back, butt muscles. Okay, we're gonna get you adjusted, all right? Arms down for me. And we're gonna go real easy with Lisa. Deep breath in, exhale out, whole way out, whole way out, whole way out. Good, breath in. And exhale out, whole way out. Good, breath in. And exhale out, whole way out. All right. All right, turn over on your back for me. Okay, so 3 B's, breathing, butt, back, right? If we don't use one of the B's the right way, like our butt muscles, if we don't squat and lift out of our glutes, we might start to put too much pressure on the front of the foot, and that can cause knee problems, calf problems, low back problems, all right? So nice, easy little foot adjustments. Boom. Okay, deep. Good. One more here. Good. Now, and every chiropractor and physical therapist is different. I like to give each of my patients full body treatment. So we work on toes, feet, ankles, knees, whatever their problems are, that's what we're going to work on. Each appointment, I try to give 1, 2, 3 exercises. We're going to show you one of Lisa's new favorite exercises that she was working on the other day, all right? Can you show me a nice deep belly breath in?
Sure.
Perfect. Abdominal breath, exhale out, right? So before we taught Lisa how to diaphragmatically breathe, she was a chest breather, chest breathing. When we take deep breath into our chest, if we lift up our rib cage and scrunch our neck, that's dysfunctional breathing pattern. We want to learn how to put air down into the abdomen, right? So Lisa has been practicing a little bit, correct? You can see, one more time, deep belly breath in, perfect. We're on the right track. Good, exhale. All right, shoulders down. We're just gonna do little neck stretch with Lisa. All right, easy on the left here, in the left, little stretch, good. And one more here, little stretch on the right. All right, that's it. Sit up tall for me. Spin over to the left. And we're gonna bend this right elbow up, nice and easy. And one more here on the left elbow up, nice and easy. All right, good stuff. Okay, so what we did in this appointment, a couple different areas we worked on. We did some myofascial release to her neck, her SCMs, her upper traps. We did some Graston technique or instrument-assisted fascial mobilization to her calves to help break up some of the tension down the Achilles tendon, the gastroc, and the soleus complex. We went through thoracic spine adjustment. We just did a little mobilization to her cervical spine. We're not really adjusting her neck just yet. We're still working on creating and reducing, I should say, some of the tension up in her cervical spine, creating better lat strength because she still gets a little tight up in her neck from appointment to appointment, right? So let's take a look at one of my favorite exercises. We're going to run her through it. You guys can check this out on the video and check out our other videos on developing better back strength, breathing, posture and breathing strength, and then also glute activation. Okay? All right. So with Lisa, one of the things that we've talked about is dropping the shoulders, right? Dropping the shoulders, pulling tension out of the head and the neck and putting it back into our lap. So step against the wall. So put your feet, back first against the wall, and then we're going to step away just like 2 inches, right up to my foot right here. So, and then we're going to step away from the wall. So stand with your back away from it. Good. Lisa's going to open her hands up nice and wide. I like to point middle finger right to the ground on both hands, and we're going to do 3 things. We're going to press our hands gently back to the wall. We're going to straighten your elbow. We're going to see it. Can I show them your awesome little tricep exercise we're getting, right? And the third thing, remember, is rolling the shoulder blades back and down. And the fourth thing is going to be lifting and tucking the chin. Look straight forward right there for me. Okay. Lisa's going to take a belly breath in. And as we exhale, we're going to press the hands. We're going to straighten the elbows. And we're going to roll the shoulders open. And we're going to hold. And about 5-second hold. We're going to breathe in, and as we exhale, press your hands, straighten your elbows, roll your shoulders open, and we want to feel this right in the mid back, right in her middle center back. Do you feel it right here?
Absolutely.
Awesome, right? Breathe into belly, and as we exhale, press your hands, straighten those triceps, roll the shoulders open, hold it, 6, 5, 4, 3, 2, 1. Breathe in, breathe out, press, straighten, and roll. All right, and that was about 4 or 5 reps. Do you feel the tension we've got right here? Can I show the video camera your awesome tricep? Straighten that elbow, roll that shoulder open, feel the burn, right? Okay, so what this is what I call a posterior wall plank, right? This is a reverse wall plank. What she's doing here is she's counteracting all of the day-to-day gravitational pull which causes us to hunch forward, and we're teaching her a simple exercise that's building her triceps and it's building her lats and her posterior deltoids, right? You feel the deltoids kicking in?
Oh yeah.
Awesome, right? So what did you tell me the other day as a bodybuilder, you're like, holy cow.
You couldn't believe the tension you feel without, weights.
Without weights. You don't have to go to a gym to get a good workout. So a lot of the things that we teach our patients are body weight exercises so we can connect that brain to body or create that brain to body connection, right? Hand press, elbows straight, roll the shoulders open, tuck and lift the chin right back, perfect. Because what happens here, people will want to jut their head forward, and you can feel, what do you feel? You feel like you're how many inches taller? Taller,
about
right?
6 inches
6
taller.
inches taller, which is helping to reduce that gravitational compression. We stand nice and tall. We hold it for maybe 30 seconds, maybe a minute, maybe 10 breaths. And we work on developing all this mid-back to tricep strength. Is that awesome or what?
Perfect. It's
Awesome.
great.
All right, cool, man. So that's Lisa's appointment where we did a little work on her calves, little work up in her neck and her shoulders. We adjusted her mid-back. We're starting to just work on a little mobilization of her neck. We're not full on adjusting it yet. And then we're giving her some rehab exercises to work on developing tricep, deltoid, lat tension, and improving her posture. So thank you so much for being part of our video. We'll see you guys on future clips.